Hello there, and welcome to Unleash the Network podcast, a podcast that aims to educate and inspire our listeners by sharing stories from Mastercard Foundation scholars and African Leadership Academy alumni who have gone on to make a positive impact in their communities and promote values of leadership, innovation, and entrepreneurship. Obra, thank you for joining me today.
Thank you for having me.
How have you been?
I'm okay. How have you been?
I'm good too. A lot of times I meet people who are interested in psychology or who are interested in human nature. They always tell me they're interested because they find the human mind fascinating and they find it interesting how humans behave. Is it the same story with you?
Well, my story has maybe two different chapters, but this is also part of it. I decided to come into psychology because of the personal experience. So I usually struggle to talk about it, but it's okay, I'll try. So growing up, yes, it was, you know, from an African background, and I'm not trying to talk about it as a cliche, but then yes, it happened. We will say that a lot of years back, it was hard to have even a conversation around mental health on the continent, and mainly from where I come from in the Francophone side. And as a child, I was actually having already some early signs of depression, but again, no one knew. Even for me, I didn't know what I had. Yeah, you're just sad. You're just doing too much. You're crying too much. You're complaining a lot. Those are basically the comments that will come, of course. So it took a very long journey. I had to see sometimes the school counselors were not the counselors that we have now. Those are counselors that usually guide you for academics. But then when you go and talk to them, oh, I'm not feeling well, they can just give you advice, which is okay. But you not necessarily have the social or psychological support that you need in a way. So it was from there that I kept on going. And then when I finally went to ALA during my second year, that's when I was able to see a psychologist, because then I was having a lot of frequent depression episodes, and also I had my first panic attack. That's when I was like, oh, things are serious, and that was very bad. I actually didn't know the name. I didn't know it was a panic attack, but it was really bad. So when I saw a counselor in psychology for the first time, I was like, oh. So the person explained to me, this is what you've been having. So diagnosed with depression and also generalized anxiety that I didn't know I had. So from there, I was like, I want to know more about this. I want to know more about what even psychology is as a whole. Years before, I was a bit interested in that because I was still trying to figure out what was going on with me. But then after talking to a professional, I was like, maybe I want to be like this person and also make others understand what they are going through. So basically, that's, let's say, the reason behind it. And yeah, and now here I am.
And so when you look at Maslow's hierarchy of need, you have the physiological needs at the bottom, and then safety and security, and then love and belonging, self-esteem, and finally self-actualization. Do you think there's stigma around mental health because some people in the continent still have to cover first the physiological needs and safety and security before they even start thinking about things such as love and belonging, self-esteem, and self-actualization?
Actually, that's an interesting question. I don't think I ever thought about it in that way. But it will explain a lot, because again, when you go into the field, like now that I'm a bit involved in mental health at home and even on the continent, so what happens is that people will be saying to you things like, we are not even done taking care of ourselves, and now you want to talk to us about this white man disease, or like this thing about our head. If we are not fine, we just figure it out. We figure it out on our own and stuff like that. So I think this could explain, but then I don't want it to be the main explanation for this. I think there are more to it, because if you notice, you'll see that first of all, people didn't know, and when we look at again at the background, we see that they mainly associated with witchcraft. So this is also one thing that we were kind of struggling with. I remember when I was telling my mom when I was diagnosed and stuff, she was like, you never told us, we didn't know. And then, are you sure that we shouldn't pray about it? And I'm like, no, okay, we can pray, but prayer is not definitely the only thing we should do, because for them, they still feel like, maybe there was like a little eye on me or something. I'm like, maybe, but I still feel like I will need a psychologist. So I also think that because it has been for a long time associated with witchcraft and all of this, so it is hard for them to shift that perception. Even now that when I do intervention with some people, you'll notice that faith will still be a good part of it, which is great. But then because some people do not allow psychology to take its place into that conversation on the continent, maybe also because we don't have a lot of professionals in that sense, or if we do, they are not accessible to a lot of people who actually need that, the services. So I think those are mainly the reasons why, yeah.
So speaking about accessibility, you started SHVoices that aims at solving the exact problem you spoke about in terms of people having accessibility to psychologists, to therapists, and to people can just help them keep their mental health in check. And how has that experience been like for you?
Okay, so the experience is, it's actually, first of all, it makes me discover a lot on the ground, because I've been out of the country for some time, studying abroad. So it helps me, first of all, reconnect with the people and try to better understand it. I remember when I was starting it, I was, brainstorming. By then I was still at ALA, I was, talking, making my plans. But when I got into the ground, I realized that, there were more needs. There were more things that that I didn't cover, that I didn't understand. And I had to, again, ask a lot of people, mainly the professionals that work at home, to be able to see how we can start the conversation. So I remember when I was trying to do my first camp, it was not easy, because when you approach people, they're like, but people are okay, why are you going to make a camp on mental health for the youth? So I was even scared to have participants. I wasn't sure that I would get anyone to come, because whenever I would talk to some people about it, they'll be like, yeah, it's great, but do we really need this at this moment in this country? We don't think so. There are other issues that we need to talk about. So those were voices that were actually stressing me out, because I was like, okay, what do I do now? How do I start the conversation? What do I say to people? But then after that, it took some time. And thankfully, I also got to talk to some psychologists at home and say, okay, this is my project, this is what I want to do. I want to do a camp. What do you think about it? And from experience, what can you tell me? What would be the best approach? So that's how I was able to actually do some revisions about what I was planning at the beginning, and then also do the camp. And yeah, the promotion was quite okay. We tried to access people online. I think that was the best way we could do that. At the beginning, we tried to approach schools, but then because the conversation is not really open in a lot of places, it was hard to get some approvals from some schools to have participants. So we just had to, go online, put flyers out there, and then that's how we got participants. Were happy. And when people wanted to have more spaces like that, they wanted to have more camps, and we're like, great, okay, we'll do another one soon. Yeah, so yeah, basically this is that. But then also now when we look at also other activities that we try to do around, again, the issue of stigmatization sometimes makes it hard. So also the issue is that now people only understand mental health through depression, and we have to tell them, no, it's not all about depression, So also trying to balance and make sure that we educate people in the best way possible. Yeah, so far the experience is great, but then challenging sometimes. But I think so far we have been able to counter all the challenges, and yeah, it's getting okay.
So a lot of times the word mental health has been thrown around and it's almost becoming a cliche to most people. But what does mental health really mean?
So usually, and yes, it has become a cliche. Mental health has definitely become a cliche now. That's even what we notice, my team and I, when we are trying to do events. Because after COVID, people started talking a lot about mental health. Yes, which is okay, but then people have been using it a lot, not in the right sense. That's the way I'm talking about how everyone is now saying I have depression. One definitely, maybe they do not have depression, but I have other things. It could be even anxiety. It could be even OCD. It could be something else. But whenever they have a small issue, they will make it as depression, because when people see mental health, mainly in my community, they will see depression, and which is not necessarily the case. We had 2 cases of suicide on the same day, about 2 weeks ago at like in my country, and people were like, "Oh, depression is not good. See how this person is suffering. Depression is not good. This is why they're killing themselves." It could be other reasons. So for me, whenever I want to talk about mental health to people, I try to look at the smallest parts that made, or the smallest issue, or like the thing that triggered the mental health. So that's why, again, for my organization, when we want to talk about it, we try to look at different issues that impact people and that can impact their mental health, and then transit from there, instead of just saying mental health, take care of your mental health, and that's it. No, we'll have, for instance, last time, like I said, when we had the webinar, we talked about harassment in school, because we noticed that this was a big issue for children and even for adolescents. And this impacts actually a lot the mental health. So we decided, okay, let's have the conversation around that. We had 2 professionals, one psychologist and one specialized educator, to talk about this issue. But then first starting at talking about that issue, what harassment is, how is it shown, how does it manifest in the schools, and how does it now impact someone's well-being, and now transiting from that to talk about the mental health. So that's usually what we're trying to do, because again, every time you can keep on telling people, okay, take care of your mental health, take care of mental health. What exactly is the person supposed to do about the mental health? This one you need to figure out. You can't just say, okay, you take care of your mental health, you go for a walk. No, not everyone wants to go for a walk to take care of their mental health, right? Some people may be struggling with that small issue. People will say small, but then which can mean a lot to them. And it can be that thing that is actually destroying the mental health. So we can't keep on telling them, take care of your mental health, prioritize your mental health, take care of yourself. But you need to tell them, or you need to rather to try to identify the problems that people are facing and talk about that, so that you see that instead of just giving a great lecture about mental health, you're actually helping them understand how the problems that they are facing are impacting their emotional well-being, their psychological well-being, even for some people who impact their physical health. So yeah, just around that.
And mental health is currently receiving a considerable amount of support, which is crucial. And congratulations on winning $18,000 from Social Entrepreneurship Fund.
Thank you. Thank you.
The work that you are doing is very important, because people need to be mentally well for them to be able to perform their job and responsibilities and to live a happy and contented life.
Yeah. Well, I'm flattered.
Good luck to the future. And I hope that you're able to keep on doing the work that you're doing, and you're able to impact more people, and you are able to help more people stay mentally well.
Thank you for having me. I think this is what we're trying to do again. That's why whenever we work, we are not trying to work alone. We are actually currently partnering with the National Program for Mental Health in my country. It's a new program they started, and then we're like, okay, great. So we can see how we can, partner for more events and try to see in the next month. And actually in April, we'll be having a first activity on suicide, because there was some cases of suicide in the 2 public universities at home. So we decided that it would be important for us to have a conference on suicide for this population, to talk to the to the students about that. So also trying to do some other activities on mental health and arts for the art students as well, for them to see how they can use the art in order to express the mental well-being, which is also important. So yeah, currently we're trying to get some more support in order to finish building the center in that sense. So trying to see how we can make it come to life and then impact hopefully more people and try to, but also the continent as well. Yeah.
Oh, thank you for doing the work that you're doing, and good luck, Obra.
Thank you. Thank you for having me.